Greetings. Let me start off by saying how excited I am to welcome all of you to this launch of CGD's initiative on COVID 19, gender, and development. Those of you who've been following our work over the last year will have seen how all our researchers have been working during the course of this pandemic to try and inform the response efforts of donors, of governments, through better evidence, rigorous analysis. And we've been looking both at the direct health effects of the pandemic, but also at the indirect effects on education, on other health outcomes, on economic livelihoods. And in all of this, considerations of gender and other forms of inequality have run right through. And one of the things that our gender team has been doing over the last year has been trying to document the gender dimension of the impact of the pandemic. And now going forward, we need to look also at the gender dimensions in the recovery to which everyone is looking. How do we make sure that in that recovery, which everyone wants to be inclusive, to be sustainable, to be green, how do we make sure that the gender dimensions are factored right into the design of the efforts to support that recovery, whether it comes to looking at schools and school closures, or whether it's looking at social welfare programs or cash transfer programs. In all of these areas, we need to be looking at the gender dimension. And there's a lot that we don't yet know. A lot of areas where we have to build more evidence, where we have to understand how different initiatives and interventions are impacting, both in terms of their immediate impact, but also some of their longer term consequences. And that's really what I'm looking forward to, the work that Megan O'Donnell and colleagues across CGD have been doing, and which we are launching today through this terrific panel. So without any further ado, I want to start off by thanking Megan, both for organizing this panel, but even more so for spearheading so much of the work that we in CGD have been doing on this set of issues, and invite her to introduce the topic and then to introduce the panelists who will join us for this conversation.
Thank you so much, Masood, and hello, everyone. Thank you all so much for joining today's event. Just going to wait a second because I have a few slides that will allow me to describe the initiative we are so excited to be launching today. Thank you, Mike. Thank you, Abdullah. All right, so I'll spend the next 10 minutes or so describing the initiative, its overarching goals, our thematic areas of focus, and the partners and audiences we are hoping to engage. After the panel discussion that will follow, we'll round out the hour with a question and answer period. So if, as I'm speaking, you have questions about the initiative, and of course, later on, questions for our esteemed panelists, please do pop those into the comment section on YouTube, tweet at CGDev, or email us at events@cgdev.org. And we'll do our best to get to as many of those as possible later on in the hour. Next slide, please. Next, yep, thank you so much. All right, so first, to take a step back and give you a quick snapshot of the work that this new initiative builds on. As Masood just mentioned, since the start of the pandemic, researchers across CGD have worked to generate evidence to inform response efforts, looking both at direct health effects of COVID-19, but also on indirect effects on employment and income, schooling and learning, mobility, etc. And as part of CGD's broader COVID work, many of us have sought to highlight both why and how considerations of gender should be integrated. And we've done this with a few considerations in mind. First is the understanding that those who already faced disproportionate barriers to equality and empowerment pre-COVID, so including women and girls, are most likely most vulnerable to the shock. And unlike in past economic crises where we've seen male-dominated sectors experience larger contractions and resulting employment losses, COVID containment measures are seen now in a range of contexts to disproportionately impact women's employment and business operations, not to mention increase the risk of gender-based violence, among other effects. Second, where we are seeing these sorts of gendered impacts being considered, a lot of the conversation is still centered on high income and formal workforce settings, places where good data are just easier to come by. So in line with CGD's focus, we're seeking to address that gap by concentrating on low and middle income countries, and especially where the impacts felt by women and girls living in poverty diverge from what's reflected in the mainstream narrative and in turn require a distinct response. And finally, I think it's clear to many of us that COVID has not just brought a short-term health crisis whose effects can be erased with the distribution of a vaccine, but a longer-term economic one. So we have to look both beyond direct health effects and short-term relief measures to ensure gender is considered and prioritized within much longer run recovery policies. Next slide, please. So with all of that in mind, and with the support of the Bill and Melinda Gates Foundation, we're excited to be building on our initial work on this topic. And through the new initiative, aim to do two main things. The first, as you see, is to increase the importance of gender equality on the development policy agendas of decision makers in COVID-19 response and recovery. Now, of course, our panelists today are already championing this sort of agenda, but through the initiative, we're going to seek to engage their counterparts working on health, social protection, economic development to make sure that this is a consideration really mainstreamed or integrated across the board. And second is to increase the use of gender equality evidence and policy analysis by all of these decision makers, a lot of which we hope to synthesize from other researchers and generate ourselves. In terms of target audiences, as many of you know, CGD's traditional focus is on donor institutions, multilateral development banks, bilateral donors who play a key role in providing financial, technical, and other forms of support to low and middle income country governments. Now, on the bilateral side, a lot of governments are turning inward to address the domestic health and economic impacts of COVID on their own populations. So this is where we see the multilaterals as particularly key actors in supporting recovery in low and middle income settings, including with regard to whether gender is considered and prioritized. The work we'll do through the initiative will also be directed towards decision makers in these countries, and critical to engaging them will of course be partnerships with researchers and civil society actors positioned within those countries who over the next year plus will inform our research priorities and hopefully also draw upon our analysis and recommendations and findings to influence actors at country level. Next slide, please. So our first thematic area of focus will be the indirect health impacts of the crisis. So not who is contracting and dying of the disease. You know, there are folks, Sarah Hawkes and others at UCL already doing good research on that from a gender perspective. But really looking more broadly, examining disruptions to wider health systems. And here we'll focus especially on sexual and reproductive health, recognizing both the immediate risks and longer term implications for fertility if SRH is not prioritized, as so much attention is directed to fighting COVID. Next, we'll also look at social protection from a gender perspective. We've seen cash transfers really come to the fore as the policy lever of choice as governments and supporting donor institutions seek to reduce the risk of rising poverty, food and shelter insecurity. And we know, from pre-COVID evidence that cash and other forms of social protection can really insulate against shocks and even reduce various forms of gender inequality. But if not designed carefully, we also know that these programs can risk exacerbating certain forms of inequality, leaving the most vulnerable even farther behind. For example, if benefits are provided over mobile phones in areas where women don't have equal access to them, or if they're just directed at heads of household who are likely to be men. So we'll hope to use this moment of COVID response and recovery as an opportunity to explore how social protection can become even more gender responsive, including by pushing for better data on who is being reached and benefiting from these programs and who may be excluded. We'll focus on broader women's economic empowerment, asking beyond social protection, what else is needed to ensure women can take full advantage of labor market opportunities as economies do start to open up again. This will ensure including financing and other forms of support directed towards women-owned firms and sectors where women are located as workers, as well as addressing unpaid care work burdens that disproportionately fall to women and girls. We'll continue our work on gender-based violence, now in partnership with the Lancet Commission on GBV and maltreatment of young people, pushing past questions we've explored on whether violence is just increasing or decreasing within the pandemic context, now to look at what donors and policymakers are doing in response and the extent to which their efforts align with rigorous evidence on what is effective. And finally, across all of these areas, we'll consider the role of women's leadership with an emphasis on how self-help groups, village savings and loan associations, and other on-the-ground organizations have contributed to promoting resilience within their communities, and in turn, how donors and governments can support them, recognizing the baseline where how little funding is currently directed at women's groups lies. Next slide, please. So here you'll see reflected the timeline for the next year plus of the initiative's work. We are currently deep in writing mode, synthesizing available evidence that points to COVID's gendered impacts, where available, starting to look past initial modeling estimates to observed effects. We're also reviewing donors and governments' response efforts to date. Many of you will have likely seen the responses at national level being collated by the UNDP UN Women Tracker on gender-sensitive COVID policy response. So we're going to seek to complement that effort by examining donor institutions' efforts, reviewing project documents to see where gender analysis, indicators, and targets have been integrated. And we'll then be convening what we're calling learning group sessions to provide a platform for discussion, both among the gender leads like the ones you're about to hear from and their counterparts working on health, social protection, and economic development. Next slide. So to take a look at some of the work we've already done on the topic and to keep in touch as the initiative develops, please check out this new URL, cgdev.org/COVID and gender. And with that, I am going to transition away from just speaking at you and into the panel portion of our event. So I will introduce our panelists. First, Caridad Araujo, who is Division Chief for Gender and Diversity at the Inter-American Development Bank. Next, we are joined by Karen Groen, who is the Global Gender Director at the World Bank Group. Keiko Nwaska, who is Senior Social Development Specialist at the Asian Development Bank. And last but certainly not least, Myra Buvanic, who is a Senior Fellow both at CGD and Data 2X. Thank you all so much for joining us. I'm going to start with a question to our gender leads from multilateral development banks, asking how your institutions have worked to ensure that gender inequalities predating the onset of the crisis have not been exacerbated during it. Caridad, why don't we start with you and then over to Karen and Keiko.
Hi, Megan. First, thanks of all for the invitation to participate in this panel and congratulations on the new initiative. But going back to your question, I'm going to give a couple of examples of the types of responses we've carried out, we've conducted at IDB. As we all know, 2020 was a particularly unpredictable year where we all had to shift the focus of our work very rapidly to provide responses to the crisis. And in terms of the bank's pipeline and portfolio, that was definitely a priority. And it was not only the focus, but also the speed of the response that mattered, given the urgency of the crisis. So despite all of these constraints, and I refer to them as constraints in thinking carefully about integrating gender in our operations, because that's something that often requires time, resources, and careful analysis. But we were able to include gender actions, diagnostics, and results in more than half of the projects that were approved last year. And some of the areas where we focused those efforts, and just to give a couple of examples, are, for example, within the health responses that were a big piece of our portfolio. We focused mainly on two areas, making sure that health services for reproductive health were not underfunded or neglected during the pandemic, and also equipping health systems to screen and respond to gender-based violence, to women who arrived as victims of gender-based violence. So those were two areas within the health portfolio. Within the social protection portfolio, which again is another one that was a big piece of our response, we worked particularly with the targeting criteria of certain programs or responses to the crisis to make sure they were more inclusive of groups of women who were vulnerable. And lastly, more in the policy and dialogue and leadership through our gender parity accelerators that are running in several countries of the region, we conducted a number of high-level dialogues to put on the policy arena the main issues of the challenges that women who were working were encountering during the pandemic. And from that high-level dialogue between public and private leaders, there were some quite interesting results in terms of policy responses, but I can share more on that later.
Would be curious to circle back to that in more detail later. Karen, over to you for World Bank's efforts on the gender front.
Thanks, Megan, and thanks to you for having us on this panel. I'd love to, like Caridad, compliment you on this new initiative, which I think is really important, and we'll look forward to continuing to engage with you on it. So even prior to the pandemic, the World Bank Group has really made concerted efforts to address those, what I call those first generation gaps in health and education, to focus on jobs and women's asset ownership, and of course on enhancing their leadership and preventing and responding to gender-based violence. And as you had mentioned, all of those issues actually have been touched upon as a result of the pandemic. I think in our response, it's been a few things that we've done, similar actually to the Inter-American Development Bank. So we took some actions immediately internally, which was to develop what we called cheat sheets for all of our lending operations to identify which gaps between men and women they could actually continue to focus on during emergency lending. And so in the first stages of the pandemic, the bank had committed to providing $160 billion in emergency response. And of course, that was for health systems. It was for things like emergency supplies, ventilators, emergency equipment, personal protective equipment, and so forth, but also to begin to extend social protection systems and to provide cash to households that where there was widespread unemployment, underemployment, lockdown, and so forth. So those two types of operations, lending operations, really kicked in. But we also felt it was important to begin to think, as we're moving into a recovery stage, what would be critical for ensuring economies are resilient and inclusive, and what can be at the front and center. So, of course, and I'll talk about this a little bit later, but one of the things that we needed to do is to ensure that we have the data. So there's a lot of anecdotal information about whether reproductive health services are in fact being disrupted or not. So through our global financing facility, we actually have been surveying health facilities to see in fact which services are disrupted, whether budgets are being diverted, and so forth. So we've done a lot of that in the beginning. Like IDB, we've really care about the sexual reproductive health. We have done a lot of work, particularly in terms of GBV prevention, because we've seen all of that data. We've used your material, Megan, the pieces that you guys have done with Amber Peterman. That's been really, really helpful. In the social protection space, which is something that's been really big, we've done a few things that I think have been really useful. We've worked with our social protection colleagues to ensure expansions, both vertical as well as horizontal. What does vertical mean? Vertical means to continue to provide top-ups, not just to the cash transfer, but for things like child care subsidies or other kinds of things that could be delivered. And then horizontal expansion is ensuring that vulnerable segments of the population that are not part of a social registry or informal employment become included. So these are populations like those who are informally employed, domestic workers, street vendors, and so forth. And those have been really important. And then for instance, in the work that we're doing in urban services to ensure, for instance, that while markets, for instance, different kinds of street markets might be closed, how do we continue to be able to provide the food, the other kinds of commodities and supplies that households need? So those are things that we've been doing. We also have elevated, I think, IDB, elevated the gender gaps in our policy dialogue. And in fact, our president is actually going to be placing an op-ed in the next few weeks on why putting women at the center of the recovery is going to be absolutely important. So our leadership, I think, is also walking the talk in providing the right kinds of messages going forward. Let me stop there.
That's great, and we will look forward to seeing Director Malpass's op-ed. Keiko, over to you to speak to the ADB's efforts.
Thank you, Megan, and thank you to CGD for inviting ADB to this webinar. And it's a great honor to be speaking about to share ADB's experience in the COVID-19 response. And we look forward to actively engaging and supporting your initiative moving forward. It looks really great. So from very early on, it was clear that the COVID-19 pandemic would be unlike SARS or the global financial crisis in terms of the disproportionate negative impacts this would have for women and girls in the Asia-Pacific region. So while Asia and the Pacific have had a pretty strong track record in reducing or even reversing certain gender gaps in education or health, it is the only global region which has a declining labor force participation for women, and women in Asia work the longest hours when their paid and unpaid work is combined. And there are many other inequalities, and including very high rates of GBV in many of our countries. So given that background, when the pandemic started in our region almost a year ago now, ADB kind of reacted very quickly and prioritized gender equality in our COVID-19 response so that women and girls wouldn't fall further behind, and also not to kind of threaten what can be very fragile gender gains that we've made since Beijing, for example, so since 1995. So in April, like the IADB and the World Bank, ADB approved $22 billion in budget support dedicated to COVID-19, and also a new kind of modality called the COVID-19 pandemic response option. By the end of 2020, there were 26 CIPROs, so they're called CIPROs as an abbreviation. So 26 CIPROs were approved, and all of those were gender mainstreamed following ADB's gender classification system. So what that means is that there were gender targets set across the three kind of priority areas of each of the CIPROs, so looking at economy, health, and social protection. So there have been some very good examples that have been already provided by Caridad and Karen, and in many cases there's been coordination at the country level. I know with the World Bank, where we have kind of similar countries. So I'll give an example that hasn't been provided though. So for example, in entrepreneurship support in countries where there was budget support for entrepreneurship, ADB would set a gender target based on the national baseline. So for example, in Tajikistan, 40% of SME kind of sector support funding would then go to, were earmarked for women. And this kind of goes across many other different projects. In addition, GBV was also a priority area for ADB. So in the Pacific, for example, that included budget support for governments to prevent and address GBV. Also included in the Maldives, helping construct shelters for survivors of GBV, given all the increasing evidence that we knew pre-pandemic and that eventually obviously has come to the fore now. That's also been complemented by different also knowledge and technical assistance at the country level to support countries in monitoring this type of budget support, and many other activities, but I'm sure that we'll get to that in following questions.
It's an excellent overview, and we will definitely continue to discuss on this front. I want to bring Myra into the conversation now. Having led gender-related efforts for years at a couple of these institutions, Myra, can you speak to what tools, what else as we look forward, MDBs may have at their disposal to ensure that gender is increasingly mainstreamed, not just into the initial response efforts that Caridad, Karen, and Keiko spoke to, but into longer term recovery?
Hi, Megan. Sure, I'll be happy to, and hi to everybody. It's a great pleasure to see you all virtually. I think that the tools are, the banks have three main tools, and they have been mentioned in a way, one way or another, by Caridad, Karen, and Keiko. But the first and foremost is the knowledge management tool. And that is for researchers to build conceptual frameworks on basis of past crises and what are the gender inequalities, and then for project officers or task team to know how to translate these frameworks into design features that are going to reduce gender inequalities. The second tool is the most probably popular one, I think, from an outside perspective, is the M&E function, right? Gender tags, gender markers, the committees, when I was at the IDB, it was the CESI. So all the kinds of mechanisms that the banks have to make sure that what is in the design gets translated into implementation. And and there can be a big gap between design and implementation. So this is the gender policing function, but part of this gender policing function, the most important perhaps of it, is the building of results frameworks that are gender informed, that have the right kind of indicators. And there's where I think a lot of work still needs to be done. There was, in fact, we had a meeting recently that it was a joint CGD Data 2X meeting where it was clear that results frameworks of these institutions, for instance, don't yet incorporate measures of women's economic empowerment. That is probably the most important thing, is going to be a very important thing to track to see the effects of the crisis. And finally is incentives. The banks have a wonderful tool for in terms of incentives, which is money. Money talks, and banks have lending, have policy lending, have project lending, have technical cooperations, have grants, and have, in the case of the World Bank, an incredible opportunity in terms of the recoveries, the IDA replenishment. But I think what a lot of people don't realize is that more and more, countries are in the driver's seat. So I think that there has to be some kind of collaboration and the knowledge by the banks to use these incentives appropriately to get countries to do things that sometimes they are not willing to do. So, and that gets into the constraints, and we can talk more about the constraints. Thank you.
Thank you, Myra. And I want to open it up to others to reflect on these three areas you've just touched on: knowledge management, the M&E function, and incentives, which may or may not be increasingly difficult, right? If countries are in the driver's seat, obviously rightfully so in many ways. So Caridad, Karen, Keiko, reflections on what Myra's just shared from your vantage points.
Well, I can jump in if no one else will. I'll take the plunge. First of all, I fully agree with Myra on the three types of tools, and we use them, and we don't always use them to their maximum potential, but I think they're all important for our institutions. I think in the middle of a pandemic, generating the knowledge is really, really difficult, and we've learned a lot of lessons about how to do that and where the gaps are, and I know we'll come to that a little bit, but we really do need, the thing that has surprised me, I think, from in the early stages of the pandemic and with some of the knowledge gathering is the fact that the gender lens disappeared. So the knowledge is at a high level, and we forget sometimes the necessity to get information from men and women or to collect it in a sex disaggregated way. And so that was something I was thinking, wow, it's 2020 and this is not yet part of our DNA in the knowledge function, but I think we've started to rectify that. But the knowledge is really critical in terms of the policy dialogue. And this is Myra's last point, the collaboration with countries. You need the evidence to really convince the client, the evidence on what works or what doesn't work. You need the evidence on where the gaps are, because it's harder for them to actually put particularly if you're talking about a country that wants to borrow using their own resources, unless they see that evidence, they may not be willing to direct their resources where they are most needed. So having, for instance, actual evidence on the costs, for instance, of diverting resources, if they're doing that away from reproductive health, I think is really quite important. And I would agree finally with Myra on the M&E function, but I think part of the issue here again goes back to an area that I think we're all moving towards. We have our own internal monitoring systems, whether it's a tag or a gender marker or something else. A lot of those systems are about processes and they're not so much about outcomes. And I think this is really complicated to think about monitoring and evaluation that helps us understand whether we're making a difference on results, making a difference for outcomes. And here, just to give you one illustration, we don't yet have consensus on what the right indicators, for example, of women's economic empowerment are. And we don't necessarily have the data systems in place to collect the data to help us know whether that's the case. Now there's, in other domains, we may have a lot of information and data, but even there, I'm actually rather surprised. So we have a lot of data in education, but in this pandemic, it has surprised me that countries are not collecting information, for instance, as schools are reopening, whether girls are returning in the same rates as boys. So there again, we need information. And as we think about the impact of our programs, that is exactly the kind of information we need to be gathering, not just information on whether our loans are quote unquote mainstreamed or gender tagged, but really on what difference it actually makes. Back to you, Megan.
Critical point, and definitely something I want to get into when we turn to constraints around data limitations. But before moving there, Keiko and Caridad, reflections on this piece?
Well, I'm happy to kind of step in, and obviously I agree with a lot of the points that Karen and Myra have just made. I wanted to just kind of reflect a little bit on the M&E function in the results framework. So within ADB, I've mentioned our gender classification system. That was definitely an incentive for ADB in all our COVID-19 response to hit a certain level of gender classification, which came from really from the top and our senior management looking keenly at our COVID-19 response to make sure that it was meaningful for gender equality. And to what extent that really leads to results is something that I think is work in progress, I think will be interesting to keep on with that discussion. Something else that we have within ADB are targets. So we have corporate targets on the percentage of our operations that need to mainstream gender equality based on our categorization system. So which meant these are at the department level as well as bank wide. So this is very important in terms of incentives for team leaders who may not particularly care for women and girls, but they do care about corporate targets. So those are kind of two kind of incentives that are related to our M&E framework. One of the things that we did introduce for this CIPRO, this COVID pandemic response option, was a gender monitoring matrix. So this has kind of opened up, I guess, a dialogue with countries on the data gaps that they have at the country level and how to improve them. And obviously, it's not just a question about flagging where you have a data gap. We have tried to match that as much as possible with technical assistance to support countries in collecting that kind of data. There's significant efforts in the Pacific, for example, on areas that we think that we should know a lot about, but even on questions about social protection, lots of data gaps there. So those gender monitoring matrices, countries need to report back every 6 months to ADB on their performance. And so we find that as a very kind of useful tool to also engage more with countries, not only kind of in the immediate kind of effect of COVID-19, but also in a kind of a medium term in improving data systems in general.
Thanks, Keiko. And I think really critical to highlight not just the incentives that Myra mentioned directed towards countries, but also those incentive structures within development banks, right, to encourage staff who may not already be gender champions to move in that direction. Caridad, any reflections from the IDB?
Yes, one very quick to add to what Karen and Keiko have mentioned, and to the provocation from Myra. I think that in terms of having evidence, one challenge that is particularly relevant in the context of Latin America that is facing this crisis with very tight fiscal spaces is not only to have evidence on different interventions impacts, but also on the cost side, because that is a super important part of the conversation. And a big challenge that often appears at that point is that when the comes with the evidence, comes from small scale or pilot interventions, because it's difficult to extrapolate those impacts and those costs to real at scale, programs that encounter real world conditions. So I think that is one big challenge in terms of informing policy, to also focus on generating evidence on at scale interventions that will be encountering different challenges, having a different cost structure, but likely also different impacts than smaller scale programs.
Thanks, Caridad. And I think that's a great segue, as we're starting to go down this road of conversation into considerations around data, whether that's the impacts of the crisis from a gender perspective, whether that's on the effectiveness of some of the response measures and interventions, or as you just highlighted, the cost effectiveness of those interventions. So on that data front, Myra, to turn back to you, where are we seeing limitations right now in terms of the data and the evidence that we do have in terms of COVID's impacts and what's effective in responding to them? And then I'll open up again to the rest of the group.
Sure. First, I couldn't agree more with you all, and especially with Karen on the issue of outcomes, and we have to measure outcomes, and that's the most challenging and the most difficult. But I will also sort of mention a big opportunity that we have. And I think from my experience of being in these institutions during past crises, the mitigation response is always just there's people are trying to do things very quickly. There's very little opportunity to innovate. But in the recovery period, and I think that here we have a huge opportunity to change mindsets and to change mindsets of all those who are working in these institutions, policymakers in countries. The big change in mindset, I think, is to realize that women are economic actors and that they should become a very important, a critical component of the recovery period. And for that, you have to really focus on women's economic activities and women's economic participation. And that's where we have the big issue. Because, and we did a work with Data2X and ODW, Open Data Watch, looking at internationally comparable statistics, indicators in the different domains of women's lives that one could then track the impact of the pandemic. The availability of data is good on health, relatively good on health. It is really poor, very poor, particularly on economic well-being indicators. Only 31%, we outlined 8 indicators to measure women's economic participation in formal sector, whatever. Countries, among 75 countries, only 31% of the countries had the indicators. So there's where we need to figure out, we need to be very creative, use the data that we have up to now, but really try to figure out that the recovery response focuses on women's economic participation. Thank you.
Before turning to others, I just want to commend, within this crisis, your institutions for having mobilized quickly to collect and analyze a lot of data that we otherwise wouldn't have had available, right? Through mobile phone surveys. I know the World Bank's dashboard that's collecting a lot of this information has been a huge resource for us as we launch this initiative. So I think worth noting that these efforts are already underway. But from a gender perspective, to others, what are some of the limitations, some of the concerns about who may be excluded from that data? Those who may not have access to a mobile phone to be responding to a survey, and broader reflections on some of the gaps that need to be filled.
So Megan, maybe I can start again in terms of answering that question. I mean, I think one of the things that is good, as both you and Myra have recognized, is the bank does produce a lot of and collect a lot of data. So immediately we kicked into action with a set of high frequency household surveys. These are using telephones, surveying populations about a range, particularly of economic impacts in terms of unemployment loss, reduced income, school closures, all of the basic demographics. Now, one of the things is that, unfortunately, because it was so quickly done, we missed a few things. And I think this is really important. And we've had these conversations through the interagency group on gender statistics at the UN. Often phone surveys may, depending on what they do, they may go to a quote unquote head of household, in which case the data will automatically contain some biases as part of it. They may miss, if they don't do a head through a random respondent, they may miss women for other reasons, as you note, because they don't own a mobile device or something else, or have a number, or there may be issues that, cultural issues, that women are not allowed to answer the phone if they don't know the number on the phone. So there are all these kinds of things that we have to think about in terms of how we sample on a high frequency basis. And that's where I think other types of data collection are really important. And it's not more for the bank, for people like us, it's probably a little bit more non-traditional. While we always go through government statistical systems, there are, a lot of community groups that are getting data. So I think about India, for instance, and the mobilization that they have. So using that kind of data to respond in crises, I think is really important. I think on the promising side, and we'll come to this, besides the household surveys, we've actually done a lot better in terms of firm surveys, I have to say. And the bank itself, I could talk about this later on, has run a number of surveys, business pulse surveys, enterprise surveys. We've teamed up with Facebook on the future of business surveys using a whole range of data that is giving us a good picture of what's happening to firms. And then on the other side, I think that it's important in the health sector. We've also teamed up with administrative units to collect data on health services and what's being provided, what's not, frequency of usage, those kinds of things, ability to pay. That is important. But where I think, as again I said earlier, I'm really kind of surprised is that I don't see the same kind of data in a sex disaggregated way being collected in the education sector. And that really worries me because that's something where we've had great data collection in the past, but I'm not necessarily seeing that in the context of this pandemic.
A really important flag. Thank you, Karen. I think for us to insist on being granular, right? Not just this overarching comment that gender data across the board is either great or it's lacking, but going sector by sector, theme by theme to be able to plug in where gaps are persisting. Keiko, Caridad, data reflections from you both.
If I might jump in, I think this crisis has also been a learning opportunity for all of us in terms of gathering and data and learning about things almost on real time. So as Karen was saying, also at the IDB, we've made a lot of use of data, for example, from Google to understand mobility patterns. We administered together with Cornell a large survey through Facebook, and that allowed us to consolidate a lot of information rather quickly. And of course, methodologically, in terms of representativeness, this might not be perfect. However, part of documenting those limitations and understanding the pros and cons and the limits of these methods, I think is a role where institutions like ours can partner with institutions like CGD to further learn and deepen our understanding on how to do better at implementing rapid response. Another source of data that has been consolidated by IDB is through our labor observatory, our COVID labor observatory that is putting together data not only from the labor service that comes out with more frequency, but also admin data from Social Security that allows us to see how formal employment is changing. So that has also been a very important resource to understand the fluctuations in labor markets. And most importantly, that does allow us to have a picture that differentiates across female and male's employment. And so we definitely start to see very different trajectories in the recovery. And that points towards the importance of a focus on female employment during the recovery efforts. And that's precisely what we've learned and what we're responding to at the IDB.
Thanks, Caridad. Keiko, any final thoughts on this piece?
Yeah, very quickly, because I think a lot of these points have already been raised by Karen and Caridad. So I've also been similarly surprised by lack of kind of sex disaggregated data in education, and in particular the impacts of school closures on girls. All I've seen so far is very much anecdotal, and that doesn't unfortunately drive policy decisions. It only drives us more to be more energetic to do something about it, but that's about it. Something else that obviously a huge data gap would be on the kind of intra-household dynamics and how that's been affected by COVID-19. We've already, I think, mentioned about social assistance and how that could be kind of how that's being distributed intra-household, but there's also kind of broader kind of changes that could kind of be looked into, and that isn't that much data on. And of course, informal female workers. So in the Asia Pacific, something like 60% of female employment is in the informal sector. A lot of budget support is obviously going to formal sector workers. So this is a huge percentage of female labor that is that may miss out from some of the support. So how we can reach them better and the different impacts that have happened to them I think still needs to be studied at the country level. We have a lot of regional and even global data, but I haven't seen so much country level data yet.
Thank you, Kaiko. I think that dovetails really nicely into a couple of questions that we've gotten from audience members. You know, you touch on the need to sort of zero in on women working informally. There's an interest in a discussion around sort of intersectionality writ large. So ensuring we're not just looking at women and girls as this sort of monolith, as distinct from men and boys, but how we're getting increasingly granular in thinking about disability, migrant status, these other demographic characteristics that may compound vulnerability. That's one question, and I'll throw in a second one for whoever wants to pick this up. I think building on, Karen, your earlier point on the ability to rely on community groups in gathering intel, data, evidence, you know, as we're in an increasingly sort of distant world from one another. What opportunity this may open up for strengthening the role of local researchers and local community sort of stakeholders in driving a research agenda going forward. So we'll throw both of those out to all of you for who's ever interested in addressing either one.
I can try to answer some of the intersectionality question as much as possible. So obviously that's a priority. Women aren't a monolithic group. So in some of our gender targeting, we also include targets for women with disabilities. In the Asia Pacific, we have many countries with very diverse kind of ethnic minorities who are more often than not accessing equitably the different benefits. So we also set targets for ethnic minorities and also migrant groups. So in our COVID-19 response to Indonesia, we have targets for migrants, migrant women and women. So it's a challenge in terms of making sure that those targets are met, but we have recognized that and we do that. In South Asia in particular, there's different work on ethnic minorities, also in Vietnam, those different types of targets are always set.
If I can, Megan, if I can speak on local researchers, and I
Absolutely.
think that is really a welcome thing from the pandemic. I mean, you know, one of the little there are no silver linings to this pandemic, but is that local researchers have come to the fore. And I have, you know, for a long time, I think I have been just very puzzled by how just narrow-minded we are in terms of just reading research that is written in English by internationally, you know, well-known research, where there's an incredible, you know, trove of good research that is done nationally. And I think that this is just the right moment to start shifting the attention and start making research really more internationally, make that meaning, you know, let's move away from just, you know, research done in the North by English speakers. Thank you.
Maybe just to quickly complement that, we have something in the World Bank group called Gender Innovation Labs that exist at the regional level, and they largely do impact evaluations using experimental, quasi-experimental methods. And one of the things that I think has been really great during the pandemic is the pivot that they've all made to collecting data at the subnational level, working in partnership with some of the local researchers and universities. So for instance, in East Asia and the Pacific, in Keiko's region, we've teamed up with colleagues looking at safe migration with local researchers. Similarly, in parts of sub-Saharan Africa on food insecurity, where the local researchers are really important in terms of understanding the context. But the point that I also want to make is I think this is where the pivot can really take place in terms of the opportunity that Myra mentioned. These are the efforts that could be scaled going forward as part of the new kind of data ecosystems that we would like to build in countries.
If I might add, at IDB, we launched at the end of last year, the Gender and Diversity Lab, which is an initiative precisely to finance research that is focused on these intersectional populations that are often understudied, and to generate more evidence that can inform policies and definitely bank operations, policy dialogue with a focus on this group. And that precisely the spirit of the lab is to partner with researchers all over Latin America in order to carry out these projects.
Thank you all. With just a few minutes left, I want to do one last round to allow for final reflections and to ask you to comment on the question that is top of mind for Myra, myself, the rest of our team at CGD, which is in your continued efforts to ensure that gender is really being prioritized across your institutions, what can we, sitting as external researchers, supporters, those focused on your efforts, do to contribute and support through this new initiative? Kaiko, perhaps we can start with you and then go around the group.
Thanks, Megan. That's a great question to finish off with. So I think Karen said at the beginning, we often look to CGD for research and evidence. And for the work that we're doing at ADB, we always look to kind of looking at global good practices. So I think for others, so we can learn on how to incorporate that. So for ADB, we try to produce new knowledge, but for us, it's very important to bring that back into operations. And I think that would apply to other MDBs also. So being able to kind of identify new ways to pursue kind of a social norm agenda through the building back better agenda. I think that is kind of maybe not a silver lining as for Myra, but it is something that perhaps we can be optimistic about, that now I think there's greater kind of awareness of the need to build back better and more equitable for women. So I guess identifying gender designs, strengthening research, and kind of working together, collaborating and coordinating efforts on data gaps.
I can go next. Well, I think that in all of the areas of research or the research process, there's a broad space for contribution and collaboration with institutions like CGD, from modeling to simulate impacts under different scenarios to data collection in real time during a crisis, specifically aspects of methods, logistics, as we were discussing earlier, to the actual research on impacts of interventions to address the crisis. All of that is useful. If anything, I would emphasize on the latter, on the impact and on the scale, on the modeling fronts, thinking about the challenges of at-scale implementation. I think that is a crucial area, often understudied and very, very relevant for the work that we do.
And I would echo my colleagues. I would also say that I think that part of the issue is really ensuring that we build a very strong ecosystem of partnerships. And I think here the issue of being able to amplify the research and the findings that we're all engaged in from our various surveys or data collection efforts. We're already talking, I know, to CGD about amplifying the launch of our Women, Business, and the Law database, which is going to be on February 23rd. And I want to flag this. I'm sorry to be so promotional, but I think it's important. Where in this year's Women, Business, and the Law survey, we asked a lot of questions about COVID-19 on labor, on family issues and violence. And just to give you two teasers, about 40 economies have introduced leave or benefit policies to help people who are still working reconcile their jobs with childcare obligations. We've also looked in the justice sector. About 72 economies have introduced measures to declare family cases urgent or essential during lockdown. So I think as we start to think about these findings that we're getting from our work, doing joint events, but I think also for you at CGD, you have a particular constituency, which is the US policymakers. And I think for you to make use of the kinds of work that ADB, IDB, the World Bank Group is doing in terms of US foreign assistance, which has always been your bailiwick, and the kind of policies, both for foreign aid, but also in terms of trade and economic rebuilding, you're amplifying the things that we're seeing from our countries could be helpful, particularly as the US pivots to a new administration tomorrow.
And here's hoping that that administration opens up new opportunities to really reposition gender front and center in foreign policy efforts. Myra, last word over to you. There you go.
Yeah, thank you. I think the policy angle is incredibly important, what we can contribute is from CGD. The other thing is measuring outcomes. I think there's a big role for CGD and other research institutions to do that. Thank you.
Short and sweet, leaving us right at the hour. Thank you all so much for a rich conversation that's really going to help to inform our work over the next year plus. We look forward to staying in touch, sharing the analyses we generate, feeding in and supporting where we can. So thank you all so much for tuning in. Have a good rest of your day.
Thank you.